So let's start by going through these 18 and what you make of this, because I'm sure a question that a lot of people have, and let's get to this second, so I'll ask you about this in just a moment, but is what happens essentially to those 15 that aren't testing positively and don't have symptoms. We'll talk about that in just a moment. But let's start on the headlines here with one person in biocontainment that is that positive test and the 2 that have been moved to Atlanta. What sticks out to you there?
Yeah, I think what sticks out is that they're leveraging this network that we're talking about, this kind of national emergent pathogens network. It's Nebraska, it's Emory, and the third one is actually in New York City. These are 3 of the kind of large places that are managed. This got stood up, Savannah, after 2014 Ebola, just to handle things like this. So I think a lot of people are trying to figure out, are those 2 in Atlanta somehow special? Yes, they are. One is symptomatic with a negative test so far, and the other person is their significant other. I think they're just spreading across the country to make a contingency plan in case they see more positives in Nebraska. What you don't want are 16 people in Nebraska to be positive and overwhelm one facility. That's why Nebraska, Atlanta, and potentially even New York City could be mobilized in order to deal with this. So what I heard this morning, incredibly reassuring. Obviously, if you're one of these passengers in quarantine, it is literally like you can feel every second, I imagine. But we can talk about what's going to happen next to those quarantine passengers.
Yeah, you really do feel for those people. They were mentioned many times. The doctor said that they were tired and they had just been through quite an ordeal. Let's talk about the other 15 that are in quarantine, because this was interesting to me. So my understanding, and this is just based on my notes from what the doctor said, they will for sure be there for a few days, but what happens after that is a question, and is this sort of individualized treatment plan. But it does sound like what I'm hearing loud and clear is they'll essentially eventually have the option to return home. They will, though, it sounds like, only be able to do so, or they will really only maybe be strongly encouraged to do so if they have the ability to keep that quarantine going, if they have a home where they're able to, stay far away from their loved ones and such. Walk us through how decisions like that would be made. And of course, I think people are just wondering naturally, if they're coming home and they live down the street from me, what does that mean for me? Should they be able to leave this facility?
Yeah, great questions. All right, so here's what's happening likely in real time, and a lot of this was touched on in the briefing that we just heard. So those passengers that arrived this morning in the quarantine unit in Nebraska getting assessed, like you said, they're in a hotel-type setting. They are for sure having their blood drawn just to be checking for evidence of antibodies, evidence of infection. And then over the next several days, that monitoring will continue. You heard the doctors in Nebraska say they're going to assess every person individually. And then depending on what happens, let's imagine that over the next several days, Savannah, that all those tests are negative, they are completely asymptomatic, they feel fine, maybe tired and worried, but otherwise asymptomatic. Then what I know will likely happen is wherever those passengers call home, they will be in touch with local public health officials. That will be a plan to be put into place as to how you can have kind of what we would imagine to be called observed quarantine. So you would have to have a structure in place where you could assure that you might not come into contact with other individuals. Public health officials locally, just like the one you've heard in from Nebraska, will have talked with their counterparts in those cities and regions and try to also have a plan. So what I want to reassure even the neighbor that might be next door would be that you would have to be in very close proximity. I can tell you that just given what we heard this morning, that these are not individuals who are going to just be left to their own devices. They are going to have close monitoring, again, probably with their home base public health officials, and that could involve more testing, just more symptom checks. How often those symptom checks will happen will likely be planned out over the next several days. Nobody, and I mean nobody, wants this to be beyond what can be contained, and I think that's critically important. I would also imagine, Savannah, there's an option that they will be given to stay in that quarantine unit so that they can be in that place. That might be a better option depending on what the home environment is like for these individuals.
Yeah, I did think they mentioned they could stay for those full 42 days if they wanted to. Also, quickly, doctors did mention it sounds like there would be a plan to, I think the terminology was, escort them to home or wherever they may be going under appropriate conditions. So that does not mean hopping on a commercial flight or something like that, you would imagine. Another thing that stuck out to me, Doctor, was there's been a lot of conversation about people who had left the ship prior to this fully being realized and now essentially being back home. We know that there are a few states, Texas, California, I think 6 in total, where Americans had returned to who had been on that ship and left it prior to us being aware of this hantavirus outbreak. They did confirm that they have been in touch with all of those passengers, and they're also being monitored, or at least in some type of touch with health officials. Is that right?
Yeah, that's correct. And as you said, New Jersey, there are a number of states that have had their local health officials, state health officials, and as you can imagine, national and kind of world response, because again, nobody wants this to go beyond kind of people who you can identify as the highest likelihood of either receiving or kind of potentially giving this virus to others. So this involves close contact tracing. Those are familiar terms to all of us. Again, what I just want to stress, this is very different from COVID because of the known quantity of this virus, as well as the fact that, as you said, in general, this is transmitted when someone is symptomatic. So close monitoring of those symptoms matters, and that's why you're hearing what they said this morning.
Yeah, I want to talk a little bit about those symptoms and also about the fact, doctor, that what we heard there is, just the way that it's called supportive care, aggressive supportive care. It's not just, there's not a vaccine, there's not just an antibiotic or something like that where you're at a doctor and they're able to give you something that reverses or stops symptoms. First, remind us what these symptoms are, because it's also like even the person, for example, doctor, in Atlanta, right, who's, especially since they're testing negative but symptomatic, those first symptoms could mean they have any other type of illness that right. kind of presents itself flu-like. Walk us through what that is and then how it is that doctors support people who do become quite ill with this.
Yeah, the early symptoms look like any other kind of flu-like illness. That's why you heard the doctors referencing that. So that involves anything from a fever, mild or even a high fever, fatigue. Sometimes you can even see just insomnia, just people who are obviously like not feeling, quote, the same, but their body kind of hurts. Those can be those early days of symptoms. It can then spread to a cough. It can get into the lungs. So then you can start to see shortness of breath. You can also start to see like a change in color in the urine. Obviously, those are more advanced symptoms. And that's when we start to see, Savannah, that high mortality rate. So the reason you heard the doctors talking about the quarantine unit seeming like a hotel, but getting temperature checks, having that negative pressure and that ventilation is so that they can pick up the mildest symptom and then be prepared on a millisecond to kind of put patients into a biocontainment unit for more of an isolation environment. So those symptoms are mild. And as you said, if someone walked into my clinic today and had kind of a mild fever and just had body aches, I wouldn't think Hunt, I would think flu. So that individual in Emory is likely sick from some other virus, which is going around right now and probably also was on the ship maybe. And that's why they're in that containment unit until they can make sure that all tests are negative and still watch that individual and their significant other.
Really good information there. So fascinating also to learn about all these systems in place, this quarantine unit, the negative pressure in that biocontainment unit, and reassuring really to hear about this entire network that stood up to kind of load balance, as I think it was called when we are in a situation like this. Doctor, before the end of the hour, just sort of put in context for us how worried you are or maybe not worried. I mean, this is, of course, a serious situation, especially for those who end up testing positive and for those who become ill, but to the broader public, what there is to keep in mind. I was reassured to be reminded that this is not a new virus. There are not as many unknowns as something like COVID, where doctors are a little bit able to anticipate what could happen here.
To the broader public, I'm completely reassured. I am absolutely confident that we couldn't be doing more. I obviously, everybody that's on that ship is being accounted for. Contacts of everybody on that ship is being accounted for. That's what I heard loud and clear today, and especially for these 18 individuals, as well as any of their contacts. There is no doubt in my mind, and that also gives me comfort. I'm going to speak to the health workers and to anyone else listening. I can't help but have like a heaviness on my chest because all of these conversations are probably pretty triggering and maybe much of the public. And I think that's also got to be acknowledged. So the brain in me is very reassured. I think the heart in me is probably also holding a little breath because, until you know what you don't know, you can't help but have that feeling. And I listened to that briefing, having that feeling, Savannah, and I imagine you did too. So that's also normal.
Absolutely. And we were lucky to have you with us through that 6 years ago, Dr. Patel, and thank you for being here with us today. And you're going to stick with us this morning as we continue to cover this. Thank you so much. Really good reminders there, really good information. Again, those 18 Americans back here on U.S. soil and being monitored now between two locations, one with a positive test and no symptoms, one with a negative test but with symptoms. And we will keep you updated on this all morning. Stay with us. The news continues right now.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.